Hi, this is Rachel Phoenix, and I'm here to talk about discrimination with addiction. Everyone knows somebody that's addicted, whether it's drugs, social media. Um, what can we be addicted to? Gambling, sex, food, coffee, shopping, smartphones, plastic surgery, tanning, exercise, social media, and cigarettes. Um, So I have worked in the field of addiction for several years now, and I do know that they're discriminated against. Um, New York State actually deems them a vulnerable population. So when they are in detox, that they have to watch. Not only do they detox from the drugs that they're affected by, but they have to detox from caffeine, and they can only have a certain amount of cups a day. They have to detox from cigarettes. They have to detox from everything. They have to give up their cell phone. They aren't allowed any of those. So, with that being said, I think everybody has some sort of form of addiction. Just ends up being drugs are the ones we most talk about. Drug addiction. Um, So, Vanity Fair released an article about the show Intervention and how harmful it was to this vulnerable population. Does anybody watch Intervention? I have watched it for a good 10 years now, and I enjoyed it until you really thought about it. So, it starts off with an addict saying that they're okay with being documented about. They don't know what the documentation's for. They don't know that they're on the show, but they signed something. So when they sign this, are they capable of signing it? Is it informed consent? Are they vulnerable at the time? Most of the time, the answer was yes. So then during the show, after it documents their progress and how they did, their families intervene and they do almost like an ambush to see if that patient can go to treatment. That's what the show Intervention is. So, does this show addiction healthy? Is this a healthy way to show it? I think not. Oops. I think not. This is not healthy. The person has no idea. It actually is very harmful to the addict, which I feel like causes discriminating. It's very upsetting. Um, During this Vanity Fair, they actually interviewed a patient or an addict that was on the show. Her name was Ashley. She was clean and sober for 10 years now, but she's upset because she has a daughter, and is the daughter going to eventually watch the show? She reports that she signed this paper when she was high, and they used they used it for the intervention. So how does this portray addiction? Not a great limelight. So here's another story. This is a good story about a woman with gambling addiction and how she overcome her addiction and started a online group that would help her community and provide support and its encouragement. The WNYT is a localized television station. How did this deal with the gambling addiction? Well, they provided a lot of resources to help out the addiction community. And so this is a very good positive attribute for the addiction population. Social media addiction. This is another addiction where a lot of people don't realize they have it. What is it? What does it look like? It's a lot of checking and scrolling through your social media. So how many of you scroll through your social media before you go to sleep? A lot of us do. Does it actually affect the brain? Studies have shown that constant scrolling causes the brain's reward area to trigger the same responses that occur when taking cocaine. but does it go hand in hand with mental health? And it's an undeniable link between social media and negative mental health, such as low self-esteem. So I found 3 different articles. Here's my references. In all 3 of them, one was good, one was informative, and one was a negative. And it seems like there is a lot of discrimination in the addiction field. I see it hand in hand when I work in the medical field, when I switch careers. I've seen doctors suggest that they shouldn't have to treat patients that have addiction because they're ruining their health anyways. So with that being said, I've seen a lot of discriminating things that happen to this vulnerable population, but it seems like the media has tried to come and assist the community with a lot of resources, and it seems like that's helping a lot. Social media is helping. Also, it's harmful as well because you have some populations, some famous people saying it's okay to do drugs or something like that. But a lot of what I have been seeing is majority of it is informative, and it's trying to help the community find resources to assist. That's it.